Okay, we are now live. Good morning, everyone. Welcome to our Audit Committee meeting for September. Do we have any apologies this morning?
No apologies intimated to me.
No, good, thank you. Does anyone have any declarations of interest they want to raise for any of today's items? No, I'm not seeing anything, so we'll move to the minute of our last meeting, which was back on the 18th of June. I'll run through it first for accuracy. Anything on what in the papers is page 3, 4, 5, 6, 7, 8, 9, 10, and 11. Okay, are we happy to accept that as a true record? There are a couple of items on the action log. I think a number of those are on today's agenda in one form or another. Is there anything to add to that, Marie?
No, I don't think so. I think just to say on the last action there, Chair, due to the timing of the governance session that we had at the end of August, I know we'd said we'd bring an update to this committee, but it's just to say that that update will now come in November. It was just due to the timing of that workshop and the outcomes of that. So we'll know more and we'll bring an update to November.
Okay, thank you. Did anyone then have any other matters arising from the last minute that aren't on the action log? I don't think I had anything. Okay, we'll move on to item 5 then, which is the Strategic Risk Register. Marie.
Thanks, Chair. Thank you. This is item 5 on the agenda, and this is the updated Strategic Risk Register for the IJB. No new risks have been added since the last report. There are currently 9 live risks, 1 considered very high, 7 high risk and 1 medium risk. Committee will note at 4.3 that it's been recognised that the risk register needs a refresh and a review to address some outstanding actions. A risk workshop with the extended senior management team took place on the Wednesday the 28th of August with our council and health risk managers in attendance as well. The workshop reviewed strategic risks for appropriateness, explored the links to operational risks as well, and discussed the potential future action plans coming from that workshop as well. The outputs of the workshop will now be subject to a meeting between myself and the partner risk managers going forward, with an update to come to November committee, as I've already stated, in relation to the action log. And we will also bring an updated action plan, which is likely to replace those the focused reviews that were in place, but we're examining which risks will now need a further focused review. So that will probably replace the current action plan. In the meantime, the current risk register was reviewed in the usual manner, with some notable changes as follows. Sorry. In relation to risk 2 governance, an IJB review is underway, with a workshop held again with IJB members on the 23rd of August, and outputs will be brought back to the IJB in the coming months. Also worth noting that management governance arrangements are also being reviewed by extended SMT. The decision-making matrix outstanding action and risk 2 for governance. I met with the Deputy Director of Finance, NHS Forth Valley, Gillian Thompson, to discuss this outstanding action, and it's now felt that this action is no longer relevant and will be addressed by the review of the governance arrangements. So I'm proposing that we would take that off of that the risk register. For strategic risk 3 partnerships, some current controls have been added around progress on locality planning and the updated participation and engagement strategy, which was approved by the June IJB. In relation to strategic risk 4, capacity and infrastructure, there are some further current controls have been included with regard to the ongoing work of the Digital Technology Innovation Board and the HSCP Digital and ICT Liaison Group, having now been established. In relation to strategic risk 7, again, some additional controls have been added whole system transformation. Primary care transformation manager is now in post. Review of governance arrangements along with the overall review has been added, and 2 additional controls added in relation to palliative care, end of life strategy and transformation board review. For strategic risk in relation to assurance, 2 further controls have been added related to the ongoing work with partner business resilience teams and the Care for People framework. And strategic risk 9, primary care, has been reduced from very high to high, following a review by the former head of primary care risk lead and the deputy medical director. The review developed a greater understanding of the challenges facing primary care and is being presented to the NHS Staff Governance Committee at its September meeting. That updates the main areas of change for this period, and I'm asking the committee to consider and comment on the report, and note an update will come in November on the outcomes of that risk workshop and the proposed updated action plan. Thanks very much. I'm happy to take any questions.
Thanks, Marie. Yeah, I mean, we know there are a number of reviews ongoing, not least the review of the integration scheme, which is still progressing through the system. That's probably going to be a bit of a theme through several of the items on this morning's agenda. So there are a number of changes behind the scenes to controls, and one suggested change to scoring in terms of primary care. And does anyone have questions or issues to raise? Jim?
Thank you, Chair. The only sort of general question I have is, obviously there's quite a number that are high, and I know we've had the workshops, etc., and the Stington plan, with the exception of financial sustainability, which obviously I'm very much under. Is there any significant piece of action with any of these that would make a difference? You know what I mean? In other words, primary care, if you do X and Y, will that reduce it from high to medium? Because, you know, there must be some of the actions will have a bigger impact. Does that make sense?
Yeah, so I suppose from the outcomes of the risk workshop, what we're going to do is we're going to work with partner risk managers, and we're going to go through each of the risks and the outcomes of that review. So we had at that workshop, we had sessions which went through in detail the controls that were sitting in the risk register and any actions that we felt that could be taken. We actually examined whether all of the strategic risks were the right risks and whether we could separate some, so that you may find that we might separate, for example, capacity and infrastructure was discussed, whether we should separate them to become 2 different risks rather than just one. So what I would say is we're going to have that focused review going forward. So I would expect that we'll bring back some changes that, you know, and what we're going to plan out, as well as where we think there should be a focused review in each of them. We're going to do those and try and do those at pace, so that we can identify and do what's called, obviously we previously referred to them as deep dives in the action plan. So what we're saying is, you know, we think that financial sustainability you've mentioned there, for example, is very high. So we know we review it constantly because it's very high, but there are going to be a series of focus reviews on each of these risks. So we would bring them back and look at any actions that we could. So
I'm guessing that the various risks from the different parts would have different weighting.
Yes.
You know, you spend more time in the ones with the highest weighting and the least time on the lowest, so that, you know,
so
that's fine.
The mitigation actions and the controls will be prioritised depending on what gets on.
So the findings of those reviews we would prioritise on that basis.
Okay, thank you.
Okay, that makes sense. Thanks for the question. Just to note that there was some discussion on the primary care sustainability risk at the NHS Forth Valley Staff Governance Committee last week. Robert was there as well. I think the decision was to agree the risk for now at the reduced level. There was some discussion around finance again, obviously, because there are some areas of primary care finance that were perhaps expected that have been victim to some of the situation we find ourselves in. I think the main discussion was around the fact that when you're assessing a risk to primary care, you're assessing a risk to 48 independent primary care providers. So that the risk overall is something of an average, and obviously there are some that are higher risk in terms of the sustainability than others. But overall, the reduction of the risk score was approved. Roger, do you want to come in?
Thanks, Chair. Speaking to a lot of members, union members on the ground looking at these risks. Obviously, they're anxious that the risks are very high and high, and that of course the anxiety is particularly about financial sustainability, which is very high. And then they look at this and they say, well, many of these controls have been put in place. Obviously, we're all anxious about them. That are not going to be put into place until March 2025, and some anxiety about why is there not a bit more sort of not panic is the wrong word, but wish to put these things in as quick as possible, given that this is such high risks.
Gail, do you want to?
Yeah, so absolutely, we're since both Marie and I have come into post, finance has been absolutely forefront of our priorities in terms of making sure that we're operating appropriately within our the amount of money we have, and we're planning for the future. So there's been a huge amount of work that's already underway and has taken place. A budget monitoring group is starting this week as well with SMT. We're going to put that as a standing item on our joint staff forum meetings as well, to make sure we've got the right conversations with our trade unions and staff side colleagues. Obviously, we've got a communication around in-year savings, around people basically taking every opportunity not to spend money unless it's absolutely essential. And it will require some difficult decisions moving forward as well. So that absolutely, just to give you that assurance, it's top of our priorities to make sure that we're able to deliver safe, effective services within the budget.
But also, we're bringing a budget strategy paper to the IGB meeting at the end of September, along with the Q1 budget monitoring report. So, as Gail says, we're taking actions already around a projected overspend that we've got in year, and that the budget strategy paper is setting out, our means to setting the budget in the way that we're going to do that in the consultation that we'll have. And we're going to have IJB development sessions as well as we go through that process, just to keep everybody informed and make sure that everybody's completely aware of the situation and the actions that we're taking.
Thank you, Chair.
Okay, thanks for those answers. Yeah, I mean, we knew at the start of the year the financial position was going to be difficult, and if anything, it's got worse in year. So there is the need for concerted action over the remainder of the year to minimise that overspend and use of reserves, which we know is a short-term solution that's not sustainable. So it'll be interesting to see that paper at the next meeting and have the discussion around the budget strategy going forward. Okay, are there any other questions on item 5? Okay, are we happy to approve that report? Okay, thank you. Move on then to item 6, which is the internal audit progress report. Jocelyn, I think you're taking us through this one.
Yes, thank you, Chair. So the report details progress since the last progress report you saw back in March, because we didn't bring one to the June committee. The completion of the 23-24 internal audit plan is set out at page 38 of your papers, and progress with the 24-25 plan is set out at page 39. The report also provides a summary of relevant partner organisation reports, which starts on page 40. So a couple of things to draw your attention to in that one. We have the summary of the NHS Forth Valley annual report, which provided reasonable assurance. And just to say that report highlighted the changes within the executive and senior leadership cohort, which is moving towards providing stability within the leadership team across NHS Forth Valley and the IJB. Leadership capacity needs to be carefully managed over the coming period, as we navigate the financial challenge. I think that the NHS Forth Valley annual report really echoes the themes in your own annual report that's the next agenda item, particularly around the importance of strategy in delivering long-term sustainability. This report also focused on the mixed operational performance and the likelihood that the challenge will continue in the medium term until strategic solutions can be found. And we also emphasise the importance of joint working to improve performance. I'd also highlight the Falkirk Council annual report, which provided substantial assurance on the Council's arrangements for risk management, governance and control for the year to 31st of March 24. And just going back to the NHS reports, we do have 3 limited assurance reports summarised here. And it was just to let the committee know that those have already been considered by the NHS Forth Valley Audit and Risk Committee. So you can be assured that they have scrutinised those reports. There's nothing else I wanted to point out, but I just asked the committee to note the progress on the internal audit plan and note the summaries of relevant reports from the partner bodies. And I'm happy to take any questions. Thank you.
Thanks, Jocelyn. That's very useful. There is a fair amount of green in the progress report, which is always nice to see. I think you're absolutely right that it's a whole system issue that we have in terms of finance and the various issues that flow from that, and it does need whole system solutions. So I think we are getting better at working together as a solution, and certainly the changes in leadership and the strengthening of leadership positions will very much help that. Okay, does anyone else have questions or comments they want to raise on this item? I'm not seeing anyone. Okay, are we happy to approve that report? Okay, thank you. Item 7 then is the internal audit annual report for 23-24. Jocelyn?
Yep, thank you, Chair. So members will remember I presented the summary report to the June committee, and that was really the executive summary, the audit opinion, key themes and key developments. This is the full annual report, and it includes detailed narrative for each of the 5 strands of governance within section 2 of the report. And the audit follow-up position is also set out at section 4. In terms of my opinion, you have heard it before, but it's set out at section 4 of the cover paper. And my opinion is that reliance can be placed on the IJB's governance arrangements and systems of internal controls for 2023-24. I won't repeat the key themes that I summarised back in June, but I did want to just touch on the action agreed to address the recommendations within the report and touch on the follow-up position as well. So we have 10 recommendations in this report, and management have provided robust and really considered responses to those recommendations. I wanted to focus on the 2 that are graded as significant. So the first action point highlights that recommendations to address several issues previously highlighted by ourselves and by others, including external audit, haven't been progressed as expected. So these are quite long-standing issues that remain outstanding, and they are recognised in the Governance Statement Improvement Actions report, which is later on the agenda. So key pieces of planned work include the revision of the integration scheme, the planned review of the MSG recommendations, and work on risk management processes that we've already discussed today. There's a very clear aim, I think, coming through to bring clarity on governance arrangements. So we're really pleased to see that and see that direction of travel. In the financial governance section, action point reference 9 is also significant, and it recommends development of a prioritised and costed transformation plan to support delivery of strategy, as well as agreement of a target date for completion and approval of the transformation plan. So the management response to this recommendation was that a budget strategy was being developed, and as we've already heard, that will be presented to the IJB on the 27th of September. And that will include formulation of transformation plans and efficiency planning over the medium-term financial period. So moving on to section 4 of the report, this is the section that provides a summary of progress to address previous annual report recommendations and recommendations from our individual internal audits. So the target dates were not achieved for 6 of the 7 actions from the 22-23 annual report, and these dates have now been extended. The Chief Officer and Chief Finance Officer absolutely recognise the outstanding actions and the need to progress these, and they've advised that a number of those initiatives will be progressed over the coming months, and action plans will be implemented and reviewed. And you know, again, that'll be reported through this committee. I think probably in summary, in terms of the follow-up position, I would say that, you know, fundamental issues do remain, but there is a plan in place to address these. And I think I would just re-emphasize what we've said previously about prioritising the areas of most importance in terms of that improvement agenda, because there is a bit of work to be done there. So I think that's all I wanted to point out. And again, I'd ask the committee to note the report in the context of evaluating the internal control environment for 23-24 and consider any actions to be taken, and note the recommendations and management responses. Again, I'm very happy to take any questions. Thank you.
Thanks, Jocelyn. Yeah, we know there are quite a number of outstanding items, but many of them will come out of the various reviews that we have mentioned several times already. I don't know, Gail or Marie, is there anything you want to say in response to that?
I suppose just for me, Chair, just to reiterate, obviously Jocelyn mentioned there that we have given a commitment to move things forward, and just to reiterate that commitment, Gail and I are very well aware of the outstanding actions and the need to prioritise these, and hopefully the responses will provide a bit of assurance to the committee and to Audit around those commitments, and we absolutely are committed to moving things forward in accordance with the dates that we've given.
Thanks, Marie. Yeah, I think the phrase Jocelyn used was definite plans to complete these, so that's good to see. But we will be monitoring progress against them as a committee, so hopefully we will see a lot of progress in the remainder of this year. Did anyone else have questions or comments on this item? Robert?
Yeah, thanks. It's around the clinical governance. So the clinical care governance framework was meant to be by the end of this calendar year, but it's now March 2025. The worrying part for me is that it's saying there's no direct clinical and care governance reports being provided to the IGB. So how can the IGB and the Audit Committee be assured that we're providing safe clinical care?
Do you want me to come and answer that one?
Yeah, please, Gail.
Yeah, so obviously we have a clinical and care governance committee, and the minutes of that committee do go to IJB. In addition, there's obviously substantial clinical and care governance arrangements throughout our partners, and our partners retain that professional responsibility for the delivery of safe, effective care from a professional perspective. So there is that assurance, but I think as we discussed in our recent workshop with IJB members, are we utilising the mechanisms we have available in the best appropriate way to make sure that the IJB is fully assured? So I think the outputs of that workshop will inform our future planning, but I think there is an assurance to a degree in place already for IJB members through the Clinical and Care Governance Committee reporting through its minutes to the IJB.
Okay, thanks.
Yeah, I think the issue that came through was while the minutes are coming through, there isn't an annual assurance statement which comes through from that committee, which other committees provide. But as you say, that's part of the actions to come out of the governance review, and we'll see the outcomes of that in due course. Kate, were there any other questions? Okay, are we happy to note that report on the basis that we will be monitoring progress against the actions in the remainder of the financial year, and hopefully have things tied up by then? Okay, thanks very much, Jocelyn. That's a very useful report. Moving on then, next, sorry, when I get to the right page in my papers. Item 8 then is the National Audit Report and Inspection Overview. Marie.
Thanks, Chair. So as a standing item, this report provides updates to the committee on any relevant national audit and inspection reports that have been issued since last reporting period. The National IJB Finance and Performance Report by the Accounts Commission issued by Audit Scotland was issued on the 25th of July. I've set out the key messages in section 4. and recommendations of the report at 4.12. The report sets out the complex landscape of considerable challenges facing IJBs, including financial sustainability, rising demand, complexity of care needs and the workforce pressures, amongst others. It also notes the funding challenges and the extent to which non-recurring reserves are being used to fund pressures, and funding gaps almost tripling over the previous 2 years from the report date, and in turn highlights the risk to financial sustainability for the majority of IJBs. The recommendations section of the report is shown at 4.12 in the paper and includes having a medium-term financial plan up to date reflecting all foreseeable costs, having annual budgets and proposed savings achievable, and clear collaboration with stakeholders regarding difficult choices to come, to work collaboratively with other IJBs and partners and share learning and develop service redesign focused on early intervention and prevention and improving recruitment and retention, work with other IJBs to understand data available and how to use it to improve outcomes, and to evaluate whether local commissioning of care adheres to ethical commissioning. I think we've heard around our budget strategy paper this morning and plans around our ongoing financial sustainability. We are working towards all of these outcomes that are recommended in the report anyway. Audit Scotland also issued a checklist of questions for IJB members along with the report. A briefing note has been sent out to all IJB members, setting out some of the key messages and also giving links to these to all of the documentation as well. Some of the key questions tied in with the governance session that outcomes and will be used as a tool for the MSG self-assessment work that's to be undertaken later in the financial year. One inspection report has been issued in relation to the MEX service. This was a follow-up inspection and improvements have been made since the last inspection and service have responded proactively. It's evaluated as 4, which is good, and this report will be considered by the Clinical and Care Governance Committee also. Committee are asked to consider and comment on this report, and I'm happy to take any questions.
Thanks, Marie, and thanks also for the briefing report on that Audit Scotland report. That was very useful. I did read the whole thing, and while there perhaps weren't any surprises, it was a pretty sobering read. I'm not sure it's particularly reassuring to know that we have exactly the same challenges as pretty much every other IJB, given how serious they are. But I think we do have plans in place as well as we can through that medium-term financial planning process to deal with the very difficult budget situation we're in. Are there questions or comments, folks? No. So again, we come back to the various reviews and the outcomes of those that will come back to committee and IJB in due course. Okay, we're happy to note that report. Okay, item 9 then is the annual governance statement improvement actions. Marie, I think this is you again.
Yeah. So committee has been asked to consider and comment on this report and note the planned review of governance arrangements and the intention to bring back an update to the November committee. This report sets out as normal the progress against government improvement actions identified. Again, since coming into post, both Gail, the Chief Officer, and myself have recognised the level of outstanding actions to be taken forward. We've already mentioned this workshop in relation to IJB governance arrangements has taken place now, with outcomes currently being collated and considered, with associated proposals to be brought back to the IJB in due course. Actions in the report are grouped into 3 categories. The first with progress with the integration scheme and MSG self-assessment, the audit committee self-assessment against good practice principles, and other internal and external audit reviews. Appendix 1 provides the current position with each outstanding action, along with the RAG status and target completion dates. Since the last report, the review of the integration scheme is progressing, supported by an external consultant. A draft integration scheme has now been issued to all participants, including our partners at Click Manager and Stirling, for comment, with the expectation that it would be remitted to Council and NHS Forth Valley and the IJB prior to submission to Scottish Government. Following those, any comments that come back. Progress in relation to the outstanding action related to business resilience, with regular meetings now in place with partner business resilience officers, as well as attendance at quarterly NHS Forth Valley local resilience planning meetings. Existing service business continuity plans are now held in Microsoft Teams and will be reviewed over the remainder of the year to March 25. A risk workshop was held with extended senior management team, as already mentioned, on the 28th of August, and the workshop refreshed our tool staff for the purpose of good risk management, reviewed the current strategic risks held for appropriateness, and examined the links to the operational risks. And again, as mentioned before, the outcomes of the workshop will now be reviewed by ourselves and partner risk managers, with outputs to be reported back to the committee in November, which will include that updated action plan, which I discussed already. I was just to note in page 103 of the pack, there's a note against, just to say, I just noticed it when I was reviewing the papers. There's a note which says, against the IJB has completed a self-assessment against the SIPFA Financial Management Code. There's a note at the right-hand side which says, report due to November 24 Audit Committee. That actually relates to the self-assessment, the Audit Committee self-assessment report, so it doesn't relate to the IJB. A guide against SIPFA Management Code, so that's to do with the Audit Committee self-assessment, so just to mention that. So that note's just sitting in the wrong place, so my apologies for that. I'm happy to take any questions on the report. Thanks, Chair.
Okay, thanks, Marie. Yeah, I mean, there are a number of outstanding items, as we've mentioned several times today, but definite plans to achieve those. I think several of them are sitting at amber, but hopefully when we see reports coming back, we can complete those actions and sign them off. Any questions, folks? Comments? No. Okay, so again, the theme very much for today's meeting is quite a few outstanding items, but we know that there are pieces of work underway that will come back to committee in due course. Okay, are we happy to note item 9 then, as it stands right now? Okay, that's the end of the agenda then. Does anyone have any other business they wish to raise? No. Okay, thanks everyone. Relatively short meeting today, but I think next time around we will probably have a more extensive agenda as some of these reports and changes feed their way through. But for now, thanks everyone for your work and for your input to today's meeting. See you all soon.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye.